medications that affect coagulation in Chapter 9. Coagulants promote clotting in our blood naturally, while anticoagulants inhibit clotting. We use coagulation mechanisms in surgery to prevent blood loss and trauma or damage to our small blood vessels. Be sure to check out the clotting cascade on page 116. In your reading on the physiology of clot formation, it talks about pathways. So we know there are 3 stages to blood clot formation. In stage 1, we have 2 different mechanisms for the formation of thromboplastin, which is a prothrombin activator. These mechanisms are extrinsic and intrinsic pathways. Extrinsic pathways are initiated by factors out the blood and can produce a blood clot in seconds. Intrinsic pathways are initiated by substances contained in the blood, and it takes several minutes to form blood clots. The clotting cascade requires calcium and vitamin K at all stages of clot forming. The difference between a thrombus and an embolus. A thrombus is a blood clot that stays in situ, or original place, or in position. An embolus is a traveling clot through our blood vessels until it reaches one area that is too small to let it pass through. Be sure to check out Table 9.1 Blood Factors on page 117 of your text. Coagulation in the operating room. Thermal hemostasis. An example would be electrosurgery, monopolar and bipolar, argon, ultrasonic device, and laser. Mechanical hemostasis. Direct pressure, fabric pads, gauze pads, sponges, suture, staples, or ligating clips are examples. Pharmacological, broken down into chemical or topical. A chemical example that we have, silver nitrate. These are activated by moisture, so we apply them to chemically cauterize the skin, which provides hemostasis or permanently destroys unwanted tissues such as warts, skin tags, or ulcers. Another example would be Moncel solution, which stops bleeding after biopsies, usually on the cervix in GYN. Topical pharmacological examples would be absorbable gel foam, which is a white sponge that is used to stop bleeding on small vessels. Another example would be Avitene or Fibrillar, used a lot in ENT cases. Thrombin. Topical thrombin comes frozen from the pharmacy, so it needs to be thawed before being used. It's usually opened right away on your back table at the beginning. It is used as a sealant, for example, to eliminate abdominal adhesions from forming. Another example is bone wax, made from beeswax, usually used in ortho and neuro. We use it mostly on bone as it is flexible. Systemic coagulants replenish deficiencies in the natural clotting mechanism. Most of the time, they are administered preoperatively. They are used to replace calcium, vitamin K, and some of the coagulation factors in our blood. Examples of deficiencies would be hemophilia, when your blood doesn't clot due to not having clotting factors or clotting proteins. This is due from hereditary vitamin K deficiencies. Calcium salts. We know that calcium is the body's most common mineral, critical for numerous body functions, one being blood coagulation. If a patient's calcium level falls during surgery, we administer calcium salts through their IV to boost their blood back to normal so they do not need a transfusion. Blood coagulation factors. 2 blood factors administered intravenously in the pre-op are called AHF, known as factor 8 and factor 9. Factor 8 is absent in patients with hemophilia and must be given preoperatively. Factor 9 is used also in patients with hemophilia and to treat excessive hemorrhaging. Anticoagulants are drugs that prevent or interfere with blood coagulation. They do not dissolve clots and are already formed, just preventing new clots from forming. Parenteral. Heparin, most common, binds to plasma proteins different in patients. Why are there variations to how patients are affected? There are different dosages or strengths. Always being sure to read the label appropriately. Has a very fast onset of action, usually within 5 minutes. It is used by anesthesia through the IV and by surgeons through flushes, injections, or irrigation. Heparin does come in units, but these units are not the same volume as the units. The difference in potency of heparin from various tissues is the reason that dosages must be expressed in units of activity rather than in milligrams. Antidote protamine sulfate. The antidote is a medicine taken or given to counteract a drug. It's used to control internal and external bleeding from too much heparin. Oral long-term. When a patient needs anticoagulant therapy, they are prescribed warfarin or Coumadin to inhibit vitamin K activity in their liver, which prevents the coagulation factors. So its Coumadin antidote, what would that be? Vitamin K. Aspirin is antiplatelet drug. Aspirin reduces the blood's ability to clot. That helps reduce the risk of blood clots forming inside an artery and blocking blood flow in the heart, causing a heart attack, or in the brain, causing a stroke. That's the benefit of aspirin. Always important to note if a patient is on aspirin therapy because they need to stop 1 week before surgery. Thrombolytics are used to treat MIs and strokes, but they do not have the side effect of hemorrhaging. They are given by anesthesia through the IV. Streptokinase is used to dissolve blood clots that have formed in the blood vessels. It is used immediately after symptoms of a heart attack occur to improve patient survival. This medicine may also be used to treat blood clots in the lungs, called pulmonary embolisms, and in the legs, deep venous thrombosis. Activase is an enzyme which works to break up and dissolve blood clots that can block arteries, used in the treatment of an acute heart attack or pulmonary embolism. TPA is the abbreviation commonly used for the drug class that encompasses all tissue plasminogen activators. However, healthcare professionals sometimes use TPA to refer to Activase because it was the first tissue plasminogen activator that was approved.